Good afternoon, everyone, and namaste. A very warm welcome to all the women entrepreneurs, professionals, and leaders joining us today. This is our seventh Web Cares and Apollo Hospitals session, and I'm delighted to see our community continue to grow, not just in numbers, but in strength, solidarity, and shared purpose. Today, we're here to talk about health in the hustle, specifically how we can prevent and manage diabetes without missing a beat in our professional and personal lives. This session falls during the week which the world celebrates as World Diabetes Day. And this year, the theme of the World Diabetes Day is something that is extremely relevant to all of you, all of us, diabetes and the workplace. And so today's session couldn't be more timely. India has also earned the unfortunate title of being the diabetes capital of the world. But today, we also know that it is also not affecting only the older adults. Many women in their 20s, 30s, 40s are being diagnosed with prediabetes or diabetes. We don't know why, but it is could be related to lifestyle because people are working, leaving very little room for their well-being. We are building businesses, we're leading teams, running households, being caregivers, mentors, problem solvers, planners, everything else, often all at once. And somewhere in between, our meals become irregular, stress becomes constant, sleep becomes optional, screening becomes optional, and health becomes negotiable. But here is the big truth: health is often not a soft priority for any of us. It is actually a leadership advantage. And when your body and mind are well supported, we think better, we lead better, and we live better. So, this conversation is very, very important. And of course, for women, even more important because of the link between hormones, obesity, PCODs, and the insulin resistance part as well, all of it will be addressed today. So I'm delighted to welcome our speaker today, our expert, Dr. Usha Ayyagri, who is a senior consultant endocrinologist at Apollo Hospitals. Dr. Usha Ayyagri is trained in Oxford University, and she has a special interest in the medical management of obesity, diabetes, gestational diabetes, and preventive healthcare. She works closely with women across various age groups, from young professionals to mothers to senior leaders, helping them to prevent, diagnose, and live well with many metabolic conditions, especially diabetes. With her MRCP from the UK and Edinburgh, the CCT, the FRCP, FRCPE, and many other certifications. Dr. Usha is a senior consultant with us in diabetes, endocrinology, and general medicine at both Apollo Hospitals and the Apollo Sugar Clinics. She practices at the Apollo Specialty Hospitals OMR, the Apollo Proton Cancer Care Center OMR, Chennai. And she's a recipient of many awards and has delivered many lectures and has also a wealth of practical, nuanced insights on how women can take charge of their health in realistic ways, not just with extreme diets or guilt or perfection, but with clarity, balance, consistency, and sustainability. So glad to have you with us, Dr. Usha, today. Thank you so much for
Thank you.
us. And let's keep this session also interactive. And I'm happy to say that we have already received many questions from our participants. We will take some of them up. But before that, we'll first explore some basic questions about how diabetes actually happens. What is it? Everybody's heard of the term diabetes, but what exactly it is, about the screening, about the practical ways to prevent as well as live with diabetes through everyday work, and also a little bit about the latest technology and innovations in diagnosis, in screening, and of course in treatment. So let's begin by asking Dr. Usha, what exactly is diabetes and why are we seeing it more commonly among women And is it true that it is also more common among women who lead extremely stressful lives?
That's a very interesting question, but going straight back to basics, what is diabetes? Most often, people associate diabetes with a high blood sugar. And certainly, that's one way in which we recognize diabetes easily. Because at the end of the day, diabetes is defined by high blood glucose levels. But if you think about diabetes, the metabolic implications of diabetes go way beyond just blood glucose levels. We know that diabetes forms one of the issues on a spectrum, primarily driven by what we call insulin resistance. So, your body is unable to use insulin effectively for various reasons. This is associated with inflammation and oxidative stress. And this becomes relevant to part three of your question of what happens when women lead stressful lives. And this combination of insulin resistance, inflammation, and oxidative stress lays a really fertile soil for diabetes, certainly. But beyond that, for things like high blood pressure, for cholesterol abnormalities, and eventually heart disease and strokes. But in younger women, the same kind of pathology lays the foundation also for other metabolic functions like infertility, PCOS. And so, if you think about what's at the root of all this, we call it the common soil hypothesis. This is a really fertile environment driven by insulin resistance, stress, and inflammation, in which all these weeds, I should say, I can't say all these trees, all these weeds bloom and then give rise to various metabolic dysfunctions. Which then brings us to the question, men and women actually have an equal incidence of diabetes. And it increases with age because insulin resistance increases with age, our lifestyles change, our weight increases. So, genetically, we may be predisposed, but our environmental influences change and make us even more susceptible with age. And then we add in stress isn't just one word. It's easy to use that one word stress, but stress brings with it irregular meal timings, stress brings with it lack of sleep, stress brings with it unhealthy diets, maybe relying on processed foods or foods that you source quickly, which may be energy dense but not necessarily nutrient dense. And stress brings with it lack of exercise. We don't have the motivation, not that we don't want to, just becomes really difficult to actually get up and go. So, one word, stress, easy to say, and again has all these implications, which then lays that really fertile soil for us as women over the age of 40 to become very susceptible to all these metabolic abnormalities, of which, yes, diabetes is one.
Also, what is it about India being also called as one of the countries where diabetes incidence is increasing? Is it a fact? And what is it that you think is the cause? Why are we rapidly increasing our diabetes numbers?
Um, Multiple factors. Number one, as South Asians, we do seem to be genetically more susceptible. But the genetics was the same whether it was our grandparents' generation, our parents' generation, or our generation. However, the rates of discovery, incidence, and prevalence, we call it, so how fast we are diagnosing and how many people are living with diabetes, is going up. And the reason for that is a major shift in our lifestyles over the last 20, 30 years. And where Indian men and women didn't even feature in the top 10 in terms of diabetes 30 years ago, right now we're in the top 5 for diabetes incidence and for obesity for that matter. We're climbing that obesity ladder very, very quickly because they're both really interrelated. Part of the reason for this is our shift away from more complex, more varied diet to a diet that's richer in simple carbohydrates, to a diet that's less rich in fiber and protein, to a diet that's more rich in processed foods, and to timings that are not at all in sync with our body clock, our circadian clock, our rhythm on which we feed, eat, sleep. completely out of sync as far as our current lifestyles are concerned. So again, all of these drive the common pathways which make us all susceptible to not just diabetes, but all the other disorders that we were talking about just a minute ago.
Right. So let's get a little bit into the lifestyle factors. But before that, let me ask you, what is pre-diabetes and what is diabetes? And I think a question which everybody asks is because today we do keep reading about reversing diabetes. So we'll get to that maybe
Yes.
also in detail a bit later. But are both these conditions reversible and treatable, or is pre-diabetes something that's more easy to manage?
So we need to think of all of these factors, whether it's blood pressure or blood glucose levels or our weight, as being on a continuum, right? There is no on off switch for this. You start, and as things change, your risk gradually increases. So let's say for your blood glucose levels, there is normal, and then there is diabetes. And we know that this carries less risk, this carries higher risk. But in between these two, this spectrum between completely normal blood glucose, so a blood fasting glucose of under 99 and under, a post meal of 139 or under, and an A1C of up to 5.6 is normal. 100 to 124 fasting, 125, beg your pardon, and a post meal of up to 140 can be, and an A1C between 5.7 and 6.4 is pre-diabetes. And anything above that is called diabetes. Now, you might ask me, why are we stressing on this pre-diabetes? Because if it's not diabetes, what's the risk? For several reasons. And that again ties into the question you asked about, is this reversible? With pre-diabetes, and this again ties in somewhat, a lot of my patients ask me, why have the numbers changed? Or kalathula, you could go up to a sugar of X, Y, and Z without being called diabetic. And now it's farmer driven, it's industry driven, whatever. We hear a lot of this myths. I have to call them myths. The reason the numbers changed, and this happened just around 20 plus years ago, 25 years ago approximately, is because our knowledge changed and science evolves, our practice needs to evolve with science. And what we know is that, for example, for kidney and eye risk, your risk of retinopathy goes up from an A1C of around 6, 6.2, so not even into the diabetes range. Your risk of cardiovascular inflammation and cardiovascular disease starts with an A1C that you would consider as pre-diabetes. And that is a window of opportunity. What you should think of pre-diabetes is a window of opportunity. It's a ladder. You can climb up to diabetes or you can climb back down to the ground floor, which is normal, right? And there are certain measures you can take. We don't call this reversal. Once it reaches diabetes, the correct term is remission. But at the pre-diabetes stage, you can prevent diabetes from developing, and therefore, or at least at the very least, delay it beyond a few years. So therefore, that pre-diabetes is a good window of opportunity, as is early diabetes actually, where you can reverse the course, stop becoming diabetic, take it back down to normal, and perhaps even in early diabetes, put it into remission. So that window is a really precious window. Cross it, closes behind you.
But what is that window, and what can you do in that window too before it closes
Exactly.
completely?
So it's that A1C between 5.7 and 6.4. And I am stressing on the A1C because your fasting glucose, your post-meal glucose can change on a day-to-day basis. You can have a slightly higher one day and a slightly lower one day, depending on multiple factors, including diet and sleep and everything else. But the A1C is relatively stable, barring certain preconditions. And with a stable A1C, you are able to diagnose someone with a bit more confidence. And this A1C between 5.7 and 6.4 actually gives you that opportunity. What can you do? The first and foremost thing, if you're overweight or obese, lose weight. This is the single best intervention and the one that will have the most impact on early diabetes and pre-diabetes. So if you're overweight or obese, come down to what is a normal BMI. For us Asians, that's under 22.9. You can calculate a BMI really, really, really easily. It's just a question of Googling it, calculate BMI, put in your height, your weight, and it'll tell you your BMI. For us Asians, that's less than 22.9. And overweight will be up to 24.9, 25, and after that, various categories of obesity. Now, what do you want to do? Losing weight is the ultimate end game, but losing weight doesn't happen by itself. Eat at the right time of the day. This is really, really, really important because eating late does increase your risk, not just for diabetes, but for other things like high blood pressure and heart disease. Number two, eat proportionately. You have to have a plate that's balanced. You need some carbs, some protein, a lot of vegetables and fiber on your plate. Limit the amount of carbs on your plate. Number three, every single day you need to exercise. There are no cheat days. The only person you're cheating is yourself. That's one term that aggravates me. Cheat days. Because whom are you cheating? It's you, it's your metabolism, it's your body, it's your health, right? So every single day, exercise. And I know we're talking about exercise in more detail later, so I'll stop with just exercise here. And
Yeah.
get enough sleep. That's one of the most neglected aspects of our life. Enough sleep at the right time of the night. We have something called REM sleep, which is restorative sleep. This REM sleep happens in 90-minute cycles, and you need at least 3 to 4 cycles to rebuild your brain connections, to reset your metabolism, and to get on the path to health. REM sleep starts only around 90 minutes after you fall asleep, and your deepest REM cycles are between 1 a.m. and 4 a.m. This is important because stress disrupts sleep. So unless you're in bed by 10:30, 11, how are you starting your REM sleep by 1? How are you getting your 3, 4 cycles in by 4 o'clock? And how are you going to wake up fresh and restored, not just in mind and body, but literally in your metabolism and your brain and your health? This is where you rebuild your neural connections. This is where you lay down your memories. This is where you cleanse, you plumb and cleanse your brain and your networks. So that sleep between 1 to 4 only starts about 1.5 hours after you fall asleep, and you need about 3 to 4 cycles of REM sleep. So this is really, really, really important to understand.
Also, diabetes is something which I think may not show up initially as many symptoms. So I think we depend a lot upon screening. And here is again something which people are not very sure about because these days we have so many different tests and they're also all packaged in so many different packages. And so
Yes.
one is always confused as to when you start testing and what should you test and how often you should test. So that is something which I thought we might discuss before we go on to all the lifestyle related questions, which I'll also include some of the things which our viewers have asked.
Okay. So I think diabetes is one of those conditions which certainly for us Indians needs to be a universal screening. So everybody should be screened. The only question is when, right? Now, there are questionnaires that are formulated for Indians in specific. And if you Google diabetes, Indian diabetes risk questionnaire, it comes up. It's just a handful of questions. It'll take you 30 seconds, 1 minute to do it. And if you score moderate or high on that, so more than 30, you need to get screened. But even if you're not in for the questionnaire, I would say if you have one or more parents with diabetes, the latest you should start screening is at the age of 40, the latest at 40. And if one is normal, then every year or slightly more spaced out. So if it's completely normal and you have a really good lifestyle, but let's say you are somebody who has a family history of diabetes, you are sedentary, you are overweight or obese, you have multiple risk factors. So as the risk factors mount up, you should definitely bring that screening age downwards, and especially for women, because the first time diabetes is often picked up for women is in pregnancy. And picking up poorly controlled diabetes in pregnancy puts the mom, the baby, and the pregnancy at a huge risk. So, for women who have any risk factors, parents with diabetes, um, sedentary lifestyles, shift work, overweight or obesity, always, 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 in fact, universally, I think a woman should get a good antenatal screening before she goes for her first pregnancy and in between pregnancies. And certainly, women should screen at the latest by the age of 40. And if you have any risk factors, earlier, please. Now, what test do we use to screen? The gold standards would be a fasting, a post meal, and a HbA1c. You don't need all tests. So, for example, if you pick up a random glucose over 200 and you have symptoms, that pretty much diagnoses it. But in people who don't have symptoms, you need at least two tests. So a combination of a fasting and a HbA1c, or a combination of a fasting and a PP, or a fasting and a random, or a random and a HbA1c, whatever is most convenient. There are gold standards, but what I say is reality and life interferes with our best intentions. So if you're at a doctor's, and that's the only time you can go to the doctors and you're not fasting, for heaven's sake, do a finger prick test. And if that gives you a risk indication, we can always give you a prescription for proper tests. But like we say, opportunistic screening for blood pressure, height, weight, BMI, and at least a finger prick glucose should be something that we check whenever a patient presents, has any contact with any doctor, just to make sure that we're not missing anything. But yes, ladies, over the age of 40, we need to look after ourselves. We need to be selfish. We need to screen for the blood pressure, cholesterol, diabetes, and a few other things starting at the age of 40 at the very least.
Right. Um, Coming to, let's talk a little more about the whole eating pattern. You did touch upon it earlier, but let's talk in the context of our audience, which I'm sure is full of women who are running around all the time and probably often skipping meals and maybe a lot of meals on the go. So I think this whole topic of how busy women who are always on the go, or maybe who are always traveling, how do they plan their meals realistically? Any tips there would be welcome.
So,
Also, if the
look,
person
it's
is diabetic, so that will be the second part of the question.
yeah, it's challenging, but not impossible. And that's what I'd say. I would probably hazard a guess that most of the women who are in our audience right now have resources. See, if we were speaking to a different audience, I might need to say it would be more difficult, but we have resources, right? Women who are entrepreneurs, professionals, life is challenging. But the one thing we can do is, especially if you're in a leadership position, I've literally just done an article for one of the healthcare magazines. Please, it's top down leadership. Look after yourself and encourage your teams to look after themselves. You have a meeting. Why does it have to be at lunchtime? Can you not take 15 minutes in a meeting? That's all it takes to have a reasonable, meal. Can you not take 15 minutes at 1 o'clock to go have a quick meal and come back? Can you not break at 7:30 for 10 minutes to grab something healthy and sit down again? So if you tell me I don't even have 10 minutes, that means that you're probably not in a leadership position and somebody else is imposing these timelines on you. Then I would say, if possible, grab a snack before you go into a meeting, a healthy snack, a fruit, a protein shake, something like that. And if and when at the earliest possible break and have your meal. Especially for people who are doing shift work, if the work timings are unpredictable, keep the rest of life as aligned with your circadian clock as possible. So let's say you're working 2 o'clock to 10 o'clock shift, which is quite common, late shifts, night shifts. Sleep at the right time. So soon after you finish, please go to sleep so that you're still getting to sleep by around 11:30, 11, whatever o'clock. Wake up and have your breakfast at the right time, have lunch at the right time, have dinner at the right time. You're working a 12 to 10 or a 2 to 10 shift, you have the better part of the morning to look after yourself and get and do some exercise. You're taking calls, walk and talk, right? There are ways of doing this. So we can create opportunities for ourselves. For women who are in a position of leadership, my most sincere plea is top-down leadership. Please make these habits integral to your teamwork, make these habits integral to how your people under you function. I work, for example, with pilots, right? Their schedules are really unpredictable. They have an early morning flight, they wake up at 2 o'clock. I still tell them, have your breakfast, lunch, dinner as much as possible in your clock's time zone, where your body clock is at, and try and get some sleep at the right time. For night shift workers, still try and keep as many of your bodily functions as possible at a time that's aligned to your circadian clock as closely as possible. But for women, be selfish. Take that 10 minutes. That's all it takes. You have something on. And you know what? Article, it is not that difficult because even if I'm ordering in food, I know that these apps have healthy options. I know that there are options I can choose that are better for me than, some of the things that are easier maybe to order. So it does take a little bit, but you get into the habit and you can make sure that this becomes a habit for you and for those under your charge.
I think another problem which people often face is about, just eating at cafeterias, and then it also might translate into, um, for example, like client dinners, or there might be a lot of eating out. So this might not even allow someone to, so you can't always refuse to do that, and neither can you always be carrying your own food. Uh, I don't know whether you would recommend that for people who do that very often, who are actually diabetic. But what would your suggestion be? Because I think more than the people who are not diabetic, I think the ones who are diabetic do need to, if they're going to do this
Yeah,
all the time, I
they
think they
struggle.
do need to think about what they should actually do if they're going to be eating out a lot.
I'll tell you one cheat code and one practical tip. Okay, the cheat code is eat before you go out. Honestly, have a high protein snack before you go out. That does two things for you. One, it'll keep your blood sugar stable and it'll help you last till dinner because when you go out to these things, um, you can't refuse to eat, you can't refuse to participate in the social activities, and therefore the quickest, simplest cheat is at 7:30 before you go out, have a high protein snack and go out. If you do that, you'll last till dinner and you will not be that hungry at dinner where you will need to overload on carbs. Number two, then there is the practical tip. You're out here socializing. If it's a buffet, you have a choice of what you put on your plate. Go for veg, go for protein. Again, this is your choice and your decision that counts there, right? I quite frequently will put a bit of everything on my plate, but I know what I eat out of it. And there is a part of going along with the crowd, and there is a part of I know what my body needs, right? Yes, people will, it may be that they care about you, it may be that they feel that, um, nobody should be, I don't doing something different or being an outlier. But wherever the message comes from, I always assume they're coming from a good place. And if they say, why don't you try some of this? I'll put a spoon of it on my plate. Nobody needs to see me pushing it away later, right? So be practical. Take I'll just tell you a personal example. I was at a conference a few months ago in Bangalore, and I wear my CGMS very frequently. It's a little sugar monitor that sits on the back of your arm. And I had um, a piece of brownie on my plate. And one of the other doctors laughed at me and said, you wear your CGMS and you eat brownies. I said, come back in 2 hours. I'll show you what my blood sugar is. And you can manage it. It's portion control. In it, I didn't have any other carbs at that meal. I had a lot of protein, I had a lot of fiber, and I had a very controlled portion of the brownie. So it is, you need to learn to eat smart and you need to learn to manage these social situations. It is challenging, but cheat codes exist for each and every one of these things. I think one of the things we don't discuss in women's fora frequently is alcohol. Tell me if you want some tips.
I think so because a lot of these social interactions, especially now, even in all age groups, I think is now does involve alcohol. And sometimes I feel that especially people who are diabetic, somehow don't associate alcohol and sugar. So I think they kind of think sugar means sweets and laddus and not some, even if that same thing goes even with a lot of
Yeah.
simple carbs, because it's not sweet. They think that, it's
Yes.
so I think it will be worthwhile to talk a bit about that.
So let's start with the basics. Mixers are pure sugar, right? So as much as possible, go away from mixers or go for slimline. So if you're looking at Cokes or Pepsis, I don't have shares in either. I wish I did. But if you have a mixer, go for a sugar-free mixer. If you're going for tonic water, you can go for a slimline tonic water. Go for soda and lemon. So use mixers that have no sugar, because all of these cocktails and mocktails are very high in sugar. They add fruit juice and they add sugar syrup. So be smart about the kind of cocktails you choose, and choose mixes that have zero sugar, and automatically that's 0 calories. So cocktails and mocktails are both sugar and calories, whereas mixes that have zero sugar are frequently 0 calories. The other thing to remember is that even wine has sugar. So be smart, and alcohol gets metabolized to sugar. Please remember that, right? So be smart about portion control. And funnily enough, hard spirits, so the vodkas and the rums and the whiskeys and the gins of this world, have less sugar in them than the wines and the sweetened wines and the liqueurs of this world. So if you're going to do alcohol, I'm not asking you to drink spirits, but I'm telling you that spirits have less sugar, and spirits with zero sugar or no cal mixes generally come with very little added calories or sugar. So that might be the smarter way to go.
Right. Of course, we have to discuss one aspect of, I think we all go through this, however good our intentions are. I think when it comes to emotional eating or sugar cravings, or, when you, I mean, you can't have it, or you know that you have to, but sometimes, it just becomes like kind of a eating related to stress, or it can be emotional hunger, as they call it. How do you differentiate between emotional hunger, or I know that diabetes also causes low sugars, or sometimes people do get these terrible hunger, and they do need to eat something. So, what's the what's the tip for that? I mean, like, how do you recognize all these
This
kinds of things?
This is a super important question. And this is a really important question because all of us struggle with it. All of us
Yeah.
fight it, unfortunately, on a daily basis. So, number one, we need to understand the basics of appetite. I've done a very good video. If you just, I don't know how you'd Google for it, maybe Usha Ayyagri appetite, whatever, appetite mechanisms, might video up. But basically, we have three mechanisms that control our appetite. One is called homeostatic. This is nothing to do with you and me. This is what evolution built. This is what will drive your prime calorie intake, because this is what you need for survival. You don't eat this, we literally starve to death. And you have zero control over this homeostatic hunger. The homeostatic hunger is inbuilt to keep you alive and to keep your organs working. The second thing is then hedonistic. To a large degree, we are taught to associate food with pleasure. I say this every single time. We do something well. What do we use to celebrate? In our culture, especially, everything is associated with food. Festivities are associated with food. Family come, we put food out. A child as well, we reward with food. We don't reward with anything else. Food and pleasure become irrevocably intertwined, irrevocably linked in our mind, to the extent that previous weight management drugs that were developed, if they interfered with this hedonistic center anywhere around it, gave suicidal ideation and people started killing themselves, and therefore drugs were withdrawn off of the market. So it is that linked, this desire, this pleasure that we get from food. This, to a certain extent, can be controlled with the newer medicines. The only thing that's in our care is the executive function largely. The executive function is the decision we make on a day by day by day. I'm hungry now. Do I go have an apple or do I have a piece of cake? That is my executive function, right? The hunger is probably homeostatic, but the executive function comes in, and this is something we can practice. This is something we can be mindful about. This is something that we can learn to modulate over a period of time. This is best done when there is no stress, because stress really, really, really messes with our executive functions, not just for this, but for anything else. I mean, when we're stressed, we drive worse, right? When we're stressed, we trip so these are things that are common, irrespective of what you're doing. Stress takes your capacity to make sensible decisions away. So the executive function is best practiced and best led when you're not stressed, and when you can learn to lay down these patterns and lay down these habits. To a certain extent, the hedonistic can be modulated and can be controlled. And this is mindful eating and to a large degree CBT work, cognitive behavioral therapy work, where you can learn to either dissociate certain impulses from eating and pleasure. It's almost like alcohol and nicotine, smoking and alcohol. Food gives you the same kind of pleasure. Those two are, you know, not banned but warned substances. Food isn't. I mean, to a certain extent, this is why people say food is a legal poison, because that's the effect it has on our body. And what do? The hedonistic aspect of it is something you can learn to substitute. If you can teach yourself either to substitute or to get equal pleasure from other foods or other activities, you can then distract yourself. So these are things that come with practice that a good counselor can help you with, and that you need to do during a time of relative peace and quiet.
Right. I'm going to add a few questions that are coming in related to food. So here's Shweta asking us if protein bars are healthy.
See, they come with a lot of additives, a lot of preservatives, and some amount of carbs. Protein is essential. Okay, let me take a step back and talk to you about basically three food groups. We all know this, right? Carbs, proteins, and fats. We need all three groups to survive. So there is no food group that's bad. If you look at the influencers on social media these days, fat's bad, carbs are bad, this is evil, that is evil. No, we need all three to survive. Evolutionary, we are built to eat all three. Less carbs, but eat all three to some degree. Number two, things that you think are protein, cereals and lentils are actually 66% carbs, 62 to 66% carbs. So they have protein, but cereals are fully carbs, and lentils and dals and pulses are also approximately 2/3 carbs. So you do get, carbs from those. The easiest way to think of food is something called the plate method. You think of every meal as a plate. About 40% or so should be vegetables and fiber, and this doesn't include root veg because root veg will come in your carbs section. About 20% should be protein, and about 30 to 40% is the carbs you put on your plate. And the reason is whatever you're eating as your vegetables and as your protein likely has some carbs. So you'll get up to 50-60% carbs, but don't put 50-60% carbs on your plate. Let's say you're having dal, rice, and paneer and a vegetable. The rice will have carbs, the dal will have carbs, some of the paneer and whatever vegetable you're adding, the peas will have carbs, and then whatever vegetable you're having may will have some carbs, may not be much. So you never put 50-60% rice on, right? Because everything else adds to that and then brings it up to 50-60%. So the plate method, where you divide it into three parts, 20% protein, 40% carbs, 40% veg, is a quick and easy way of keeping track of proportionate eating at every single meal time. Protein bars, processed food, I'm never a great proponent of. I would never say eat anything processed. You have many good sources of protein, vegetarian and otherwise. And if you're vegetarian, I would recommend a protein supplement, which is a pure protein powder with no additives and with no preservatives or not many preservatives, rather than a protein bar. And if you are not, if you're a meat eater, hello. I mean, you can get enough protein if you portion out your meat across the week appropriately. But if you're a vegetarian, it can be difficult. And then a good quality protein supplement will do the trick for you rather than anything with a lot of added sugars, added preservatives, and added carbs.
Right. The other question is from Anita, who asks if poha is said to be healthy. Is it okay to have it on alternate days?
Poha is just flattened rice. That's all poha is, right? And you're eating rice. If you're eating rice, stick to the principle I told you. It needs to be, carbs need to be 40% of your meal. So I don't care in what form your rice comes, whether it comes in the form of poha or khichdi or dal chawal or rice or whatever. It's rice. You need to keep it to less than carbs to less than 50-60% of your total meal, and carbs on your plate to less than 40%. If you're eating just poha, that's 100% carbs. There's nothing else in it.
Right. I think we will now move on to the exercise part of it, and then I think we should move on to the actual diagnosis and treatment of diabetes and the symptoms. So, Doctor, what do you think? So again, exercise is one thing which everybody knows that ideal to aspire for, but then most of the time it becomes like, I don't have time, or I'll start on Monday, and the Mondays. So, and it also is a situation where, give my own example, that you start off with Monday, Tuesday, Wednesday, and then you just get tired, and then you probably don't do as much on the end of the week. And then there's what exercise? Is it going to be like walking, running, gymming, or doing weights? Don't do weights. So maybe a quick suggestion on what busy women can do to incorporate some movement and uh, resistance training in their lives.
So some general information about exercise. Okay. To stay healthy, and I'm not talking about to lose weight or to manage diabetes, just to stay healthy, you need 30 minutes of brisk exercise per day. Now, brisk is a walk where you're walking, you can talk but can't sing. So you need to get to that pace where you can talk but not continuously. If you're talking with a friend and walking, you're not walking fast enough. You're able to hold a continuous conversation. So you should be able to talk but not sing, and that's a good brisk walk. And that's just to stay healthy. This will not help you lose weight. This will not help you do anything other than keep your heart a little fit. If you want to lose weight, and that should be about 5 days a week minimum. So 150 minutes minimum per week. And this is the basic, the very least that you should be doing. If you want to lose weight, you nearly need to double that. So you need to do just over 60 minutes, about 6 days a week. And the other thing we must remember is that cardio alone, which walking is never going to be enough. We need strength training. It doesn't matter if you're slim, you need muscles. Okay. And the reason I say this is, for us, we burn our calories in our muscles. Our muscles are what keep us metabolically healthy. We burn our sugars in our muscles. That's number one. So metabolic health depends on your muscles. But for women post menopause, we lose bone strength really, really, really fast. And there are things we can do about that in terms of building it to a good peak and then slowing down the loss. Topic for another day. But what then keeps us from fracturing things when we slip and fall is actually the muscle strength. So if you have muscle support, your hips and your knees, and your balance is good, and you're able to walk briskly and not strip and not slip, and you have a good core, then the fall risk is less, and lesser falls means lesser chance of fractures. So you're not actually reducing your fracture risk by doing anything to the bones, you're reducing your fracture risk by stopping from falling. And the final thing is, sarcopenia is a word that everybody recognizes now. Your muscles melt with age. Along with everything else that goes wrong with age, muscles melt with age. So doing strength training becomes even more important as you age. And building those muscles early on so that you have enough when you age is really important for women, more so than for men. What kind of exercise? Anything you enjoy and you can do for the rest of your life. So if cardio wise, anything that is accessible, affordable, and enjoyable, these are the three criteria. If you can access it, there's no point in me telling someone to go swim if their nearest swimming pool is 10 kilometers away and they will not get in a pool, right? So pick an exercise that you can easily access every single day of your life. No point in me telling them to go and join a 10,000 rupee gym if, so accessible, affordable, enjoyable. Because if it's a punishment, you will not do it the day 2, day 3, day 4, day 20, day 70, right? Strength training, you can use your own body weight at home to do, or some basics like a couple of 2 kg dumbbells and some resistance bands is all you need. But even using your own body weight, you can do a lot of strength training. How much? Well, don't tell me you don't have 10 minutes in your life. If you have nothing else, you can find 10 minutes twice a day in your life that you're spending on your phone or that you're spending watching TV. Fine, you're watching TV, get up and work out when you're watching TV. I'm not saying go away from your enjoyable things, incorporating your exercise into things that you're doing already. Incorporate your exercise into things that are part of life. Like I said, walk and talk. If you have a phone call that you can take and you can walk and talk, walk and talk. Get up and exercise. Do bursts of exercise, because bursts are as good as, well, depends on your objective, but bursts are better than nothing. Let me put it that way, because how your fat burning works with sustained exercise is different from how it works with bursts of exercise. But at least bursts are better than nothing. And if you can only do 10 minutes twice a day, do high intensity so that the effort counts. So if you're only going to go for a 10-minute walk, it's not going to be much use. But if you're going to have only 10 minutes, then make it a good jog if you can. And the final thing is, if you've never exercised, don't expect to start a 1 hour walk on day one and then still be able to do it on day two. Start slow, start low, go slow. Give your body time to get used to your exercise. Give your body time to recover between exercise sets. So you may need to start maybe alternate days for 10-20 minutes, or 10 minutes twice a day for alternate days, and gradually build it up to where you want to be. So the basic principles, you need cardio plus strength training. You need to build it up to being enough either for cardiovascular health or for weight loss and metabolic health. And you need to build it up slowly enough for your body to cooperate with you and get there. No point in doing the marathon on day one and not being able to move on day two.
Um, we have quite a few questions actually, but I just want to ask one or two before we quickly, because we are running a bit short of time. We have about 10, 12 minutes left. But I must ask you about treatment, the diabetes, and because there is people know about insulin, they know about metformin, they know about the new medications. But I also want to club this with two questions which have also come in. So here is where one person from the audience has asked if untreated non-alcoholic fatty liver is the reason for type 2 diabetes. Why does the doctor prescribe diabetes medicines right in the beginning instead of suggesting changes in the diet or using kitchen ingredients to detox the liver? And there's another viewer who's asked about HbA1c 6.7. Can I eat rice? And do I need metformin? And there's another one also asking about glycomet, which is also one. So
Okay.
I think so there is a good amount of all these names being known, and also people often think that, why not start with just lifestyle? So when do you need medicine and what kind of, I mean, like when does it go on to insulin? So all that, if you can tell.
Okay. So, firstly, why do we treat diabetes? We treat diabetes because we know that longer term, untreated, uncontrolled blood sugars kill every single organ in your body. And I'm not being dramatic in saying kill, I mean kill. Head to toe. Okay, uncontrolled diabetes for women, hair fall. I mean, they come to me more often with hair fall than with any other complaint. Doctor, my hair is falling. Well, there are reasons for it. Medically speaking, uncontrolled diabetes is one of them. Strokes, right? Eyes, cataracts, glaucoma, and retinopathy. Then your thyroid, for women especially, hypothyroidism and type 2 diabetes do travel together. Then your heart, you do have a higher instance of all kinds of heart disease with diabetes, including heart failure and heart attacks. Then your liver, fatty liver disease is a co-traveler, um, you know, along with all the other markers of this inflammation and oxidative stress. Fatty liver disease also is one of those manifestations. Kidney failure, other than, in fact, diabetes is the most common cause of people ending up on dialysis. And other than road traffic accidents, diabetes is the most common cause of amputations, right? Head to toe, you pick an organ, your diabetes kills it. Wherever blood goes, sugar goes with it, and the organs bathe in excess sugar, the sugar damages the organs. So this is the fundamental, this is why we need to treat diabetes. But is treating sugar alone enough? No. Along with the sugar, we need to make sure that your body weight is controlled, that your blood lipid profile, that your cholesterol levels are at a good range, and that your blood pressure is controlled. These are the fundamental basics. If I'm looking at, we call it multifactorial or multiple risk management. The risks that we treat are your heart, your kidneys, your liver, your cholesterol, everything. Now, no, fatty liver disease is not a cause for diabetes. The underlying pathology, which we discussed right at the beginning, is common to both. Insulin resistance, obesity does increase the risk of fatty liver disease and also diabetes, and quite frequently they travel together. But no, fatty liver disease does not cause diabetes per se. People with diabetes and obesity have more than 90%, 80% likelihood that they will have fatty liver disease, but it is not a causal relationship. And forgive me for saying this, and I know influencers all over the world will probably come after me with lighted torches. I don't care. There is no such thing as a detox. Your liver is a wonderful organ that detoxes itself. Your kidneys are a wonderful organ that detox your body. Your liver and kidney don't need anything for you to do to detox anything. Yes, a healthy diet is essential for all of us, but that's because you want to reduce your inflammation, you want to reduce the stress, additional stress you're putting on your body. And yes, there are certain foods and lifestyle interventions that can help support that. So, for example, turmeric in our kitchen cupboard, for example, the spices, the ginger we use, all these things are really good. But so patients come to me and say, I have methi and it helps me control my blood sugar. Well, there was a study, if I remember correctly, out of Chandigarh that showed that yes, methi has one substance that controls blood sugars. But to be able to get enough to control your blood sugars, you need to take something like 3 teaspoons to get a good blood sugar controlling effect. Because to concentrate it, to get enough to control your blood sugar. Now, tell me who's having a teaspoon of methi before every meal? And to have a few dana, I say no harm, no foul, okay, fine. But yes, you can eat healthy, but that's nothing to do with detoxing your liver. For heaven's sake, all of us should be eating healthy to help support our immunity, our body, make sure that we're not. Processed foods are incredibly inflammatory. We know all about palm oils, we know all about fructose, we know all about high fructose corn syrups. So we should be eating healthy, we should be eating sensibly, we should be eating to not damage our bodies. As far as diabetes treatment is concerned, drugs, insulin. What your body lacks is insulin. What your body will eventually need is insulin. People come to me and say, but insulin is end stage. Well, when most people are diagnosed with diabetes, we have anything between 40 to 60% of our insulin reserve left. If you take a healthy person as having 100% insulin, then by the time people are diagnosed with diabetes, you have about 40 to 60%. This insulin secretion gradually decreases. Various things influence it, but about 3 to 5% per year, let's say 3.5 to 5% per year, right? And things like obesity and the diets we were just talking about can all contribute to a faster decline. And having a good health, having your muscles burning the sugars, putting less strain on your pancreas, and being a normal weight will all help slow down the rate of decline. But at some point, people with type 2 diabetes will run out of insulin. And then they will run out of their own insulin production, and then they'll need insulin from outside to support. At some point, if you're lucky enough to live long enough with your diabetes, and now since diabetes is being diagnosed younger and younger and younger in our Indian population, most of us will end up needing insulin, unfortunately. Sometimes we use insulin short term in between around surgery for pregnancy, but eventually insulin will become a long-term requirement. Again, I keep saying this, if you're lucky enough to live long enough with diabetes, your pancreas will need some support. Medications wise, yes, I saw that metformin had a few questions in there. Metformin is a very commonly used drug, but we do have more newer medicines that have less risk of low blood sugars and that actually help benefit your kidneys and your heart, because ultimately what we're trying to do by controlling your blood sugars is make sure that your heart, your kidneys, your eyes, your limbs stay attached to you and stay healthy, and that your whole system is one happy system. And there are drugs that can actually help support our kidneys and help support the heart and make sure that the incidence of heart attacks, heart failure is less. There are now also newer drugs that not only help with blood sugar control, but also help you lose weight, and they're very effective for weight loss. And since we started at the beginning and we said that insulin resistance and obesity are the root cause for all of these syndromes, losing weight improves your insulin resistance, improves your insulin sensitivity, and that will lead to an improvement in your blood lipid profile, your fatty liver, your heart risk, and everything else. So, treating the root cause, which is your insulin resistance and your obesity, with these newer drugs actually helps on multiple fronts, not just diabetes treatment. So, insulin is sometimes a requirement. Unfortunately, people delay it too long, and that is why it becomes an end stage instrument. But quite frequently people need it for a lot longer before they agree to go on it. But nowadays we have really good meds that can address your weight, your insulin resistance, and combined with lifestyle. And I will say this, whatever I'm talking about in terms of treatment, lifestyle, like we talked about, eating right, eating healthy, eating proportionately at the right time, sleeping enough, exercising enough, keeping your weight in a good range, every single managing stress, exercising every single day, anything diabetes related is built on a foundation of these 6 pillars. There is no diabetes management without these 6 as the pillars holding it up.
We must definitely have a little mention about PCOS because that is kind of related and it
Indeed.
affects women. And so maybe some quick uh, tips on what is PCOS, how do you how is it linked with diabetes and lifestyle even?
Indeed. So, PCOS, I think, is most often recognized because girls get irregular periods. They go and see somebody about it, and then they get told you have PCOS. But actually, to diagnose PCOS, you need more than just irregular periods. You need 3 things. You need hormonal abnormalities, you need cysts on your ovaries, and you need irregular cycles. Now, when I say hormonal abnormalities, they can either be blood work abnormalities or clinical, like acne, hair growth, things like that. So we call it signs or lab evidence of hyperandrogenism, so androgen excess. You need cysts on your ovaries, which is an ultrasound thing, and you need irregular cycles. Now, some guidelines say you need 2 out of 3, some say you need 3 out of 3, but these are the fundamentals. So, girls and women who have PCOS, and remember, it's not PCOD, that was a 25-year-old term. We now recognize that it's not a disease, it's a spectrum. And we say spectrum because, again, there is one end where girls get a few pimples, a bit of hair growth, or nothing. And there is the other end where they have everything, the irregular cycles, the excess androgen, the acne, the hair growth, and the difficulty getting pregnant, infertility, all these things. But underlying all these is one common thing. PCOS is not an ovarian dysfunction, it is an insulin resistance syndrome. The insulin resistance drives the ovarian hormones, not the other way around. Reduce your insulin resistance and your PCOS improves. How can you reduce your insulin resistance? Exercise, weight loss, and sometimes medication. Right? Putting somebody on an oral contraceptive pill regularizes the periods but does nothing else for PCOS. And because PCOS is fundamentally a problem with insulin resistance, eventually the same insulin resistance that we've been talking about since 3 o'clock will eventually give you the diabetes, the cholesterol, the heart disease, and everything else later in life. So, women with PCOS today are high risk candidates for all the metabolic abnormalities later. But remember, women with PCOS are a higher risk of diabetes in pregnancy, which is a major thing. So, if you do have PCOS, please get this managed, get your lifestyle in order, lose some weight, and get your insulin resistance down before you think of a pregnancy, because managing a pregnancy under those circumstances is really challenging for the doctor, anxious for the patient, and the associated risks to mom and baby can be minimized. And women with PCOS should be screened for metabolic abnormalities at least once a year. When do we start? Depending on whether other factors, including family history and weight and things. But yes, I would start reasonably young because, again, they might be planning a pregnancy and I want to know their blood glucose status to be able to advise them appropriately for pregnancy. And for even if you're planning a pregnancy 5 years down the line, I need to know your sugars now, because if you're pre-diabetic now, I have time to change it. I don't want to discover you're diabetic or pre-diabetic just as you're planning a pregnancy in 3 months' time.
Right. So I'm going to, I think there are many, many more questions and many aspects to discuss. So we should do
This is
actually
the kind of topic where we could talk for a whole evening and
yeah.
still not exhaust the questions or the information.
But so I have to end now. So I would like to just end by asking you to give, if you were to give one message to every woman who's kind of sitting there running her business or managing her work or her KPIs, writing her goals late at night, what would you really tell them?
Be selfish. When it comes to your health, be utterly selfish. I'm sorry, but we have to be as women, because if we don't look out for ourselves, I'm not impugning any of the others in our lives. I'm not casting any aspersions on them. I have a husband who cares for me, but if I'm not selfish, then no amount of caring from anyone else helps. So, and we are, it's ingrained in us from childhood not to be selfish. As women, it's ingrained in us to give, give, give. I'm sorry, when it comes to your health, be selfish. If I say only one thing, when it comes to your health, be selfish. Take the time to eat on time, take the time to exercise, take the time to look after yourself. Everybody else, you can only look after anyone else if you're looking after yourselves and you are healthy. Your oxygen mask first, everybody else's next.
I think
Flight rules.
think life
Your
happens.
mask
There's
first,
never a
everybody else
good
after.
time to start that thing. I think you just need to go with the flow. Well, so thank you so much, Dr. Usha, and
Pleasure.
thank you,
Absolute pleasure.
dear VET members, for joining us as women who build, lead, nurture, and influence. I also think it's important to carry all these messages down to your colleagues, to your friends, to your family, of course, and I think to people who work with you. I think women should so even at the workplace, I think as women leaders, you should make sure that women who work for you, for that matter, everybody who works for you, with you, reporting to you, or you report, I think it's always good to carry messages of healthy lifestyle. Diabetes, we have learned today, is not just about numbers, it's about a lot of awareness, rhythm, balance, planning, consistency, all things which you already do so well in your work and in your work, family balance, and your caregiving. So, as Dr. Usha says, it's time to bring all of that and all your KPIs and dashboards into your health and your body and your consistency and your regularity and your planning. When a woman takes charge of her health, it is not just taking charge of her own health. She actually strengthens every team and every home and every enterprise that is connected with her. So,
Yes.
thank you for choosing to join today. And I hope this is the beginning of starting a great self care routine. So, stay healthy and thank you for being part of this event. Thank you so much, Dr. Usha, once again. Thank you, Web, and I hope to see you again very soon. Namaste.
Thank you very much, everyone. And look after yourselves. Put on your mask and offer a sister a mask. Bye bye.
Bye.